Dr. Medina, and today I will show you how to dissect a fetal pig, and I will also be identifying the organs. So what you want to do first is, I'm going to start off by cutting off the umbilical cord so you can see if it's a male or female. You can tell if it's a male or a female. You can tell if it's a male or a female because it'll have an umbilical vein that will be right under it. But since there is no umbilical vein, it should be under here, and that makes it a female. So first, you want to start off by cutting like right under the chin, and you'll want to start off right there. You want to take your time because if you speed through it, you may cut some organs or you may cut some very important tissue that will be shown. And there's also some cartilage, but since this fetal pig has been born not too long ago, the bones shouldn't be fully developed. So just make sure that you take your time, and you want to go around the umbilical cord, not straight through it, because there's something important that I want to show you later. So just remember, take your time. And you want to cut all the way down to here. So when you get to right here, that's when you can kind of start getting a little deeper because you know where you've cut. And you'll want to grab your forceps to lift this piece of skin up so you can see where to stop and where to keep going. Make sure to not cut this little vein here because that is very important, and I will tell you why. So the reason why you should not cut this is because this is the umbilical vein and it is connected to the umbilical cord. The umbilical vein goes all the way to the liver. You might just want to cut this a little bit so you can see. So while you're cutting, just make sure that you don't cut any other organs, and also cut a little bit down so that some liquid can come out. So you'll want to grab a pin and just pin the skin down. Poke it through, into. Grab another one. Okay, so I'm going to grab my probe, and so as you can see, this is the umbilical vein and it goes all the way down to the liver. But since it's kind of holding it back, I might just want to cut this. Okay. But don't cut it, make sure that you cut it in the middle. And so grab your probe again and then identify these. This is the urinary bladder, the one in the middle. And this is the umbilical artery. So the umbilical artery is the first and third one, and the urinary bladder is in the middle. I don't know. I can't really get my probe under it, but you should get a hint of where it's at. And then second, I want to identify the small intestine. And the small intestine, it's very shriveled up, and it is, I might want to cut a little bit of skin down here. Drain out this liquid so you can see other organs. Remember, make sure to also cut away from you. Never cut towards you, because you can make a mistake and cut too hard, and you could stab yourself. So this is the small intestine. It is a very tube-like organ, and right next to it, I'm trying to see if I could find it. I don't know if it's on. Okay, here we go. Right here, this is the large intestine, and the large intestine is separate from the small intestine, but if you look at the human large intestine, it goes around the small intestine. So just make sure that you point that out when you're dissecting. Just may want to drain out this liquid. Okay, and so down here, if you go a little down, I wonder if I could find it. It's under all of this tissue. Okay, so it's right here. And under this pouch-like substance, which is called the peritoneum, and peritoneum helps fight off germs, and it allows your intestines to move around. And that's something you don't know when your intestines are moving around, because you can't feel it. So you may want to just take your scalpel and cut right through that. Cut away from you. And what the kidney does, it cleans your blood, and it also helps with your urine. And the kidney looks somewhat like a bean. It's very small. You just want to push this away. I'm going to see if I can cut this out, just so you can get a view of what it looks like inside of a fetal pig, from the difference between fetal pig and human. And I'm making sure to not cut this, so you can just see this is a tube in your, and this is the tube that where your urine goes all the way up to your urinary bladder. You just want to feel that. And if you look at it closely, they have these little fuzzy things. It looks like under, and this helps just protect your kidney. If you cut this open. So as I was saying, this is the kidney, and if you kind of just separate it from like one side to another, it has these little bitty fibers. So I want to put that down. You want to look at that. And so, second, what I'm going to do is I'm just going to cut off this extra skin just to get this out of the way. I may want to use my scalpel. Make sure you watch where you're cutting so that you don't cut any important organs, because you want to see everything. I want to use my scissors again. As you're cutting, you'll start to hear some cartilage, but the bones aren't fully developed, so it's kind of easy to cut through. And if you look at this, like, it's pretty shiny. This is the peritoneum, and it helps fight against germs. And it's very slippery if you just run your finger around that. So, yeah. And if you look right under the liver is a pretty big organ. And some people get the liver mixed up with the heart. But if you look right under the organ, you'll feel this little pouch. And if you press on it, it's filled with liquid. And this is the stomach. And the stomach helps you digest when you eat, of course. And I'm just going to cut this out so you can at least see what it looks like on the inside. If you look at this, you can see a bunch of biome. Like, I just want to drain that out and squeeze it. this is what it looks like. And it's, if you look closely, you can kind of see these little bitty fibers. I don't know if you can see it, but it's also really smooth. And right under it, if you can see, I'm going to crouch down a little bit. Right under it, you can see the spleen. And the spleen has this little bitty tissue that's keeping it in place. So I'm going to take my probe and kind of just cut that. It's very thin, so it doesn't require much effort to cut. And the spleen helps fight against germs. Pardon me. So just want to cut that open. It's very easy to cut open. This way. Spleen. And it also has this little substance of like little bitty fibers, and it feels like velvet if you touch it. And I'm just going to move up to the chest cavity. I want to get my scalpel and cut right through that. There's this tissue that's protecting the heart, so you'll want to cut that through so that it makes it a little bit easier. Cut through the rib cage. It's not that, it kind of requires a little bit of effort since it's been developing. Cut this little bitty pouch that's surrounding the heart, peritoneum. You want to just cut this extra skin so that it won't be in your way. I also have, like, if you have pins, you can just pin the skin down, but I prefer to cut it. So if you look at the heart, which is this big organ that's in the chest cavity, you'll see that there's this pouch, and this is peritoneum. And the peritoneum protects the heart from germs, which is around it. Just going to cut this out. I want to cut a little bit more. Cut the rib cage. Make sure you don't cut yourself because these scissors are pretty sharp. Make sure you also want to make sure you know where you're cutting. Just okay. So this is the heart, and this is the right ventricle. No, sorry, this is the right atrium, and this is the right ventricle. This is the left atrium. I can't seem to find the right atrium. So what I want to do, I just want to cut this out so you can get the sense of what it'll look like, what shape it is. Careful when you're cutting. Actually, I think I'm just going to leave that there. But these are the lungs, right, that's surrounding it. And if you cut the lungs, most lungs are hollow, but the fetal pig lungs aren't that hollow. They're actually kind of filled with a tissue. And I think that's all I want to show you. So thank you for watching my dissection video, and I hope you enjoy.